Tommy's out today. Glad to be here with you. Medicare's open enrollment period starts in just 10 days on October 15th. And whether you're newly approaching 65 or you've had Medicare for years, there's a lot to learn about the program for yourself or if you have parents who are going to be enrolling or need to make changes. Dr. Brent Wallis joins us from People's Health to talk about Medicare and Medicare Advantage plans. Good morning, Doc.
Hey, Dave. How you doing this morning?
I'm doing all right. This can be overwhelming and confusing for people, so I'm glad you're here to help us kind of simplify it and help people understand it. There are a whole bunch of parts of Medicare. What are the different parts?
Yeah, it's pretty confusing. So it's good to have a little bit of an overview. There's 4 parts of Medicare, and we label them parts A, B, C, and D. So Part A is actually the inpatient hospital insurance. So that's what's going to cover you for any care that you get in the hospital or a skilled nursing facility or even a hospice care facility. And then Part B is actually the medical insurance. So that's going to cover all of your outpatient services, so things outside of a hospital. That's going to be things like preventative care services. It includes vaccines, any of your screening tests. But it also covers things like durable medical equipment. That's things like CPAP machines and oxygen, wheelchairs, walkers, and even hospital beds.
All right, that's A and B. So what are parts C and D?
Yeah, so Part C is actually Medicare Advantage plans. So that's things like People's Health. Those are actually plans that are offered by private insurance companies. And it's another option for getting your Medicare coverage. And then Part D, actually D is for drugs, so that's your prescription drug coverage. And it's important for people to realize that Part D is not automatically offered under Original Medicare. You actually can get Part D coverage through Medicare Advantage plans, or you can buy them separately as what's called a standalone Part D plan. And what's really important is once you become eligible for Medicare, the government actually requires you to have that prescription drug coverage. And what that means is that if you don't have that coverage, if you don't elect to buy it, then you may have to pay a penalty if you get it in the future.
All right, A, B, C, and D, but you have to have D or you could be penalized. Tell us about more of the differences between Original Medicare and Medicare Advantage.
Sure. So Original Medicare is really a combination of Parts A and Part B, so your hospital and your outpatient. And Original Medicare is administered by the federal government, and it's going to cover services that are considered medically necessary. It doesn't cover any additional services, so things like vision exams, dental exams, hearing aids, things like that are not covered under Original Medicare. And that's why a lot of people will choose to join something like a Medicare Advantage plan. Medicare Advantage plans cover all of the services that Original Medicare covers, but they offer what we call extra benefits as well. And that could be things like a fitness center membership, maybe transportation to and from your doctor, things like I just mentioned, the routine dental, vision, and hearing services. And then many Medicare Advantage plans also automatically include that Part D prescription drug coverage, so you don't have to worry about enrolling in a standalone plan as well.
All right. So with Original Medicare versus Medicare Advantage, does that also impact where you can go and which doctors you can see?
It does, yeah, it definitely can. So Original Medicare allows you to go see really any doctor or receive services at any hospital that accepts Medicare. So that's anywhere in the United States. But with certain Medicare Advantage plans, you actually have to stay within what they call a network. And what the network is it's a group of providers or healthcare facilities that have contracted with that Medicare Advantage plan, usually to provide services at a lower cost. And some Medicare Advantage plans will let you see any provider. So going out of network, for instance, you can do in certain instances, but generally you're going to pay a lot lower cost if you stay within the Medicare Advantage network. And then the other big difference with Original Medicare and Medicare Advantage is usually the cost. So with Medicare Advantage, you pay something called a deductible, before Medicare begins paying any of your health care services. And then once you meet that deductible under original Medicare, you'll usually pay a 20% cost share for anything that you receive, so up to 20% for the cost of any services.
All right, so the Advantage plans and the original cost differently, but what is the cost of a Medicare Advantage plan?
So, it really depends because the Medicare Advantage plans can all be different and have different benefits included in them. Some of the Medicare Advantage plans do have an annual deductible. They may have a monthly plan premium, so something that you have to pay in addition to your Part B premium, which you have to pay under original Medicare. But there are some plans available all throughout Louisiana, some people's health plans in addition, that really have a $0 premium and no annual deductible. So your coverage begins immediately without any out-of-pocket cost. And then with Medicare Advantage plans, your other costs that you're going to have to think about are things like co-pays or co-insurance for covered services, or even your prescription drugs. And those are going to vary from plan to plan. It can get a little bit confusing, so you have to look at all the tables. But really the biggest thing is, regardless of which plan you choose, your overall costs with Medicare Advantage plans are typically lower than under original Medicare, especially if you're using medical services. And the reason for that is that Medicare Advantage plans are required to limit your yearly out-of-pocket cost. So what that means is that when you reach that ceiling, you don't have to pay anything else, whereas with original Medicare, there is no ceiling on yearly expenses, so you continue paying that 20% indefinitely.
Dr. Brent Wallis, Dr. B, is our guest from People's Health, as open enrollment is just 10 days away for Medicare here in 2023. There was a lot of information, and sometimes it's hard to follow. So when we come back, I'm going to ask Dr. B, how do you know which coverage is right for you or for your parents? We'll get Dr. B's thoughts on that coming up after we check on traffic on WWL. 824, Dave Cohen in for Tommy Tucker, and we've been talking about open enrollment opening in just 10 days for Medicare, and I know it can be overwhelming and confusing, but it's very little more important in the life of our 65 and older crowd, or to the parents of folks who have parents who are 65 and older, to make the right decision when it comes to their medical coverage. So Dr. Brent Wallis from People's Health is here helping us try to understand it all. Doc, how do you choose the coverage option that is best for each individual?
Yeah, like you said, it's a tough decision. I know I've had to sit with my mom and go through all of this to try to figure out what makes sense. And really one of the first things you have to decide is, do you want to stick with original Medicare or do you want to go with the Medicare Advantage plan? And then if you decide Medicare Advantage, there's a lot of different plans with different benefits that you have to consider. So one of the first things is actually the cost, which is important. A lot of people are on fixed income. You want to make sure you know what your potential cost is for the year, what's going to fit your budget. You want to consider things like we were talking about, deductibles and plan premiums, all of that stuff, so you don't over your budget. And then the other thing is coverage, which is critical. Who do you need to see? Who are your doctors? What do you think is going to happen in the next year with your health? Can you make sure that you're seeing who you want to see and go where you want to go? And then definitely, do you take medications? If you're on prescription drugs, are those drugs covered, and what is it going to cost you to continue on those? And then finally, kind of the last thing to think about is those extra benefits that I mentioned, things like fitness and dental, vision, hearing. Do you need any of those? Would you use those extra benefits? And if you think you would, then you may want to steer a little bit more towards Medicare Advantage, because those benefits bring additional value to the health plan, but only if you use them.
All right, so you decide if you want traditional Medicare or you want an Advantage plan. If you decide you do want an Advantage plan, how do you pick the right one? I know that they do have, star ratings?
Yeah, there are. Like I mentioned, there's a lot of different Medicare Advantage plans, and the benefits can vary. It can get very confusing. And so what Medicare has is they've developed a star rating system, and it's kind of an overall rating that gives you a little bit of a comparison between plans. And it's a little bit more of an objective measure. It tells you how that plan has performed in the last year. and really takes into account several years beyond that as well. Are they improving the care they're delivering? Are they a high-quality plan? And really what's critical is, are their members satisfied with it? Are they sticking with the plan, or are they leaving? And so it's a good way to compare plan to plan. The thing that's really exciting is in a couple of days, actually, Medicare star ratings for 2024, so for next plan year, are going to be announced. So they're coming out in the next couple of days soon.
So people can make their decision ahead of the open enrollment opening on October 15th. That makes sense.
Yeah, absolutely.
All right. And now is that time, though, to be making these decisions, isn't it?
Yeah. I mean, it's right around the corner, like you mentioned. Annual enrollment. It's really the time of year where everybody should take the opportunity to look at their coverage, look at what they think they need. Did they get new diagnoses in the last year? This is usually your one time of year, where you can make changes to your plan or enroll in a new plan. It runs. Open enrollment runs from October 15th to December 7th, so you've got a little bit of a window to make those changes that'll go into effect on January 1st of the new year. And keep in mind that the health plans can change from year to year, so coverage can change, benefits can change, and then you change, things that you're experiencing, and like I mentioned, new diagnoses. So this is really the perfect time to kind of look at what's available to you on the market and make the best decision that's going to work for you or your family.
So not necessarily just, we'll just stick with what we did last year. Not always the best decision, because things change in the plan and in the person. How can folks find out more about People's Health?
Yeah, with People's Health, you can actually come and speak with us in person. We've got representatives at our Medicare Center, which is in Metairie. It's located right at Veterans and Causeway, right next to Party City. And, we take appointments, but walk-ins are welcome as well. We actually have a lot of in-person benefit presentations there and also across all of Louisiana. So you can go to our website at peopleshealth.com/meetings, and it'll give you an idea of the various places you can go throughout the state to learn more about original Medicare as well as the Medicare Advantage plans that are offered.
Dr. B, always a pleasure. Thank you for joining us. And we should remind people that WWL and People's Health will team up for an event on Tuesday, October 17th, right after open enrollment opens, where WWL will broadcast from People's Health and help get your answers to your questions. Dr. B, thank you so much.
Thanks a lot, Dave. Have a great week.
You too. Dr. Brent Wallis here on WWL.